Hello, hello, and welcome everybody to Overtime. My name is Nicholas Lamar Souter. Yes, it's the in time interface. Nothing to see here. Everything's good. Um, Eddie Van Halen died today. He died of cancer. He was 65. I lament that there are plenty of people who don't know who that was. But before we go into the sort of flurry of things to discuss, I wanted to point out that tomorrow we're going to be having a hang on After Dark on this channel here. We're going to be having a hang to discuss Schadenfreude and the general feeling from a great many people, certainly on my side of the aisle, that Trump got what he deserved when it came to COVID, and the occasional comment by people saying, well, gee, I kind of hope he doesn't make it. And I think that's a conversation that needs to be had. We had Cyrus the Skeptic joined us in the Discord yesterday. He made some good arguments. I understand his arguments. He made one from utility, essentially. We've lost now 200,000, actually 210,000 Americans by the more conservative way of calculating. 200,000 Americans to this. If we had started wearing masks early on when we should have, as many as 80 to 90% of those could have been prevented. And COVID's going to be with us for a while. So people sit there and say, well, what does it matter? It matters because we're going to have other treatments, and they're coming through. They're coming with treatments, vaccines, new ways of dealing with it. The more people we can keep alive, the longer, the less suffering there's going to be throughout this entire thing. I always have Schadenfreude is the final E, and then the final E is pronounced Schadenfreude. Senator Porpoise is going to have to teach me how to say that correctly. At any rate, I think what was it? I was talking about Cyrus the Skeptic, who came onto our Discord yesterday. We'll be dropping a link. I'll be on our Discord immediately after this show. Maybe we can coax Cyrus back. He had a good argument. He talked a little bit about the trolley problem, which is an ethical problem anyone who's dabbled in philosophy knows about, and discussed why, in his view, that why he really was hoping we'll get into that. Hopefully he's been invited. We have Vox Publius has been invited and has already accepted, so she will be there tomorrow, as will Christopher Mouty. And we've asked Nathan Lawyer to come on, and hopefully we're going to have a good panel to discuss this issue. Also, then on Columbus Day, we're going to have just a very brief nick of time. It'll just be a 5-minute segment on who Christopher Columbus really was, because that is history that is profoundly misunderstood in this country, and I think it's important for people to be educated on who that man really was and what he really did, because very few people, actually nowadays it's becoming more, the consciousness of it, and people are becoming more and more aware, but he was a very bad individual. And then on October 13th, World War III, we will be discussing with Professor John Shook. He came on to discuss generations theory, and now he's going to be discussing why generations theory predicts a massive event of some kind, either a civil war or a world war, specifically within the time period starting in the last 2 years, going on for the next 8. So we will discuss that, and hopefully you guys will join us. Trump tweeted that a Democratic win would, quote, shut down our economy and jobs. An hour later, Goldman Sachs came out and told its clients that they think at this point there is evidence suggesting that there will be a blue wave in this election, and that Democrats may take back control of both houses of Congress, and they actually only lost the Senate, but take back control of the Senate and the White House, and that as that becomes more likely, they are actually upgrading their forecast for economic futures and advising their clients to stay and hold on their long-term investments. Moody's Analytics has found that if Biden's economic proposals were enacted, it would create an additional 7.4 million jobs over Trump's economic plans. Meanwhile, the chairman of the Federal Reserve, Jerome Powell, has said that right now the greatest risk to our economy is a second wave of coronavirus, which would, quote, more significantly limit economic activity, not to mention the tragic effects on lives and well-being. He also added that managing this risk as the expansion continues will require following medical experts' guidance, including masks and social distancing. He also reiterated that the need for financial stimulus in helping America's most vulnerable is profound and it is urgent. He said that the risk of doing too little stimulus is far worse than the risk of not doing enough. Quote, the U.S. federal budget is on an unsustainable path and has been for some time now. But this is not the time to give priority to those concerns. Trump has halted stimulus negotiations, halted them earlier today, and is now holding them hostage, saying he will not continue with the stimulus negotiations until after the election. Quote, I've instructed my representatives to stop negotiation until after the election when, immediately after I win, we will pass a major stimulus bill that focuses on hardworking Americans and small businesses. This came as a shock to his own advisors, the people doing the negotiations on his behalf, and the Democratic negotiators, including but not limited to Nancy Pelosi. This also caused a 600-point swing in the Dow Jones, which lost 1.3% on the news, and we will all be watching to see what it does tomorrow. Yeah. We have someone here saying that 250,000 Americans die of various causes. Well, yeah. That's why we deal with various causes. Nobody's saying drop everything to go, oh, dear Lord, yeah. That's sort of like saying, well, why bother going to see a doctor? People die of medical conditions all the time. You're going to die of something. What does it matter what you do? Oh, my God, the lunacy of that argument. Well, yeah. So, I will say this, and this dovetails in with tomorrow's show. Google is reporting that searches for the word Schadenfreude have gone up 30,500% following Trump's diagnosis. 30,000%. Biden now has an 8-point lead in Arizona and has in fact been ahead in Arizona for the last month. Now, this is the first time in about 40 years that a Democrat has had that much of a lead. Arizona itself hasn't voted for a Democratic president since 1996. Democratic senator also stands to flip the one of the Senate seats down there. Trump is down 16 points nationwide in a poll of likely voters. 9 in 10 voters now say that they have already made up their mind. That seems a little high, but okay. Trump has left Walter Reed now, saying that he feels fine. He is on a very high dose of steroids, and we know that when you start taking steroids, especially early on in this illness, you start to feel immediately much, much better. But the illness is still attacking his system, and it takes a considerable period of time before your body can really mount an effective defense against it, even when you're getting the best medical support in the country. Trump is now saying that this virus is nothing, we'll be fine, we have to, quote, we have to learn to live with it, just like we're living with COVID, which is a direct quote, so I'm not sure how we learn to live with COVID, just like we're living with COVID. I'll get the code breakers on that one. But he tweeted, in most populations, COVID was far, far less lethal than the flu. That is irrefutably false. Not even close. Moving on. The mortality figures, now there's been a number of analysis. We reported initially that the mortality figures for his age range, which was 65 to 74, which he's 74, so he's at the upper end of that, was 8%. 8% of people in that age range, when you remove and don't consider any other factors, just at that age range, 8% die. At the next age range, starting at 75, it goes up to 18% die. Now, when you factor in those other factors, and when you factor in looking at his mortality rate, not in a static groups, but in terms of an actual graduated scale, because he is actually at the top of that age range. You'd expect the middle of that age range to have roughly 4%, no, sorry, 8%, and then higher, you get higher. His estimated mortality rate by some doctors at this point, including the head of, New York, I'll have to look that up. I apologize, I don't have it on the top of my head. But they've estimated now that his rate is actually closer to, or his estimated chance of dying of this, all other things being equal, which they're not because he's receiving the best medical care. Excluding that, his mortality rate would otherwise be about 16%. 16% without the medical assistance that he's getting. So that's pretty high. He has done a number of extraordinarily reckless things, including getting into his limousine and driving around. He was obviously driven by Secret Service and had other Secret Service in the limousine with him. The problem with this is that the limousine is sealed against chemical attacks. It's hermetically sealed. So you put somebody with COVID into a sealed environment that's recirculating the air with people who aren't sick. The Secret Service is purportedly livid over this. It was a political stunt. He just did it because he wanted to show everybody he was strong, and he has now endangered the lives of the very people who protect him. When he got back to the White House, he took off his mask and said he was perfectly fine, and this is easily fightable. Right now, most doctors are suggesting that what we can expect to see is, or that there is a very good likelihood that he is going to start to deteriorate. What he is feeling right now almost certainly is just sort of almost a rebound high from the high amounts of steroids. He was starting to feel ill. He's only early in that process, so a huge amount of steroids is going to make him feel a whole bunch better. But as he continues on that process of getting worse, he's going to get sicker again. This early treatment hopefully will help him, and it may be he's not going to get that sick. There are people who get COVID and show no symptoms at all. Rare for his age group, but it does happen. So let's see. The general consensus is he is probably not out of the woods, but in fact, early on in this, usually it's about 10 days after the initial onset of symptoms that this becomes the absolute worst it's going to get. His onset of symptoms was probably, what were they saying? Oh, I forget the date. I want to say the onset of symptoms was clearly, the evidence is clear that we've been lied to. They said he had no symptoms. People were noticing symptoms as early as Tuesday. So it looks like that would be 7 days ago. So they're expecting that he's going to start to take a significant downturn within about 3 days. That's the expectation. May not happen, but that seems to be what the most likely outcome is at this point. Again, also the most likely outcome is he'll survive. Even a 16% mortality rate that's high, but it still means the chances are far greater he's going to be okay. There are a number of indicators that that his illness is greater than people have let on. First of all, there is the coy nature of these press releases and conflicting reports. Official reports are that he's doing just fine. Unofficial reports are that he was having extraordinarily labored breathing. At one point, you could see the veins on his neck were starting to bulge. This happens when you're having breathing difficulty, when your diaphragm is having a hard time getting insufficient air. And those of you who have children, who have seen children in severe like SIDS or respiratory distress, what you see is their entire body starts to breathe. The neck starts to contract. You can actually see the rib cage as the skin gets sucked into the rib cage as all of the chest muscles are working to get air. And it looked very much like, and I've unfortunately seen this more than a few times, and it did look like that when President Trump was speaking, and you could see his neck muscles were convulsing in that way. So it suggests that he's having breathing troubles. Breathing troubles were reported by his chief of staff and by unofficially by a few unnamed sources who said that he clearly was having breathing troubles. We now know he had to be put on oxygen twice. It looks like his oxygen went into the mid 80s, which is extraordinarily serious. Actually, let me get into that in a second. So we know that he's had a chest X-ray and lung scans. We don't know the results of either of those. He appears to have instructed his doctors not to tell anyone, which admittedly I do think for most people is certainly their right, and there is the right to privacy. For the President of the United States, it's probably still a right, but there is a public interest in having that knowledge. And you do give up certain privacies. He's the one who wanted the job. He's the one who ran for the job. So he's going to have to give up some rights to privacy when the, quote, leader of the free world is this sick. At any rate, it's not my decision. So, but let's see. Based on the timeline of the illness, it looks like he's about to enter this critical 7 to 10 day phase in which some doctors are saying they expect him to take a turn for the worse. The oxygen levels of the blood appears to have been in the mid 80s. Now, we don't actually know. There's no way to know. But Dr. Conley was asked repeatedly what was the lowest the oxygen levels reached, and he said that, quote, the oxygen never dropped below the low 80s. Never dropped below the low 80s. Now, this is somebody who is presumably trying to mitigate people's fears, which means that's the best he could say. I mean, if the best he could say was it never dropped below the mid 80s, he'd have said the mid 80s. He said the low 80s, which means it was probably in the mid 80s. Even in the high 80s, experts say that that is a sign of severe illness. Usually they consider putting someone on a ventilator if they're going to be below 90 for any extended period of time. Below 90 is considered sufficient to have decreased mental capacity, as is the shock of steroids and experimental treatments that they have now given him. So there is considerable evidence that he should be mentally impaired. If he's operating like most human beings, you get that low in oxygen, you get high on, and for the record, most people know I had COVID, and my pulse ox dropped reasonably low, and I started to actually just get high from it. I didn't find it particularly painful in many ways because I was high most of the time from the lack of oxygen. But you combine that, and and we've spoken about my own experiences, but nonetheless, many of the medications that he's been given, including dexamethasone, are explicitly for people with severe lung issues. It's not even given to COVID patients who don't yet have a lower respiratory infection. So this is more, we talked about this, I think, 2 nights ago. This is now more evidence that they believe he's got a lower respiratory infection. By the way, I will add one other thing. You can often tell by the lack of evidence when something is true. If his x-rays came out clear, if his lung scan came out clear, he would demand that it be released and that people say, hey, this is President Trump. He's the big man who can ride a horse, or whatever the equivalent is for Donald Trump. And you can see how virulent he is because his chest x-rays are perfectly fine. We didn't get his chest x-rays. In my view, combined with everything else, that's a significant sign that something's wrong. The reason he got into the limo and did the circuit was because he wants to show how strong he is. If he could show that with his chest x-rays and come out and say, hey, they were perfectly clear with no chance of getting busted lying, he'd do it. He hasn't done it. Why not? Now, we do have a super chat, so let me actually quickly get to that. That was Jake 4D. Thank you, Jake, very much for your $5 super chat. There are people who don't get symptoms. There are also people who are good people who do well in office. $5 says Trump is neither. Touche. I very much concur. Thank you. Thank you very much, Jake, for your support. So, yeah, we'll have to get into pandemic deaths. Yeah, okay, I'm not going to get into that. So, where does this stand? The At this point, I mean, first of all, if this were Obama, you just know the conservatives would be sitting there saying that we should invoke the 25th Amendment. He is absolutely and irrefutably. Well, no, I shouldn't say that. I mean, we don't have evidence that he's mentally compromised, but when you give a human being these steroids, when a human being loses pulse ox like that, or sorry, just blood ox like that, they're compromised. That's the whole reason for the 25th Amendment. Nonetheless, that I'm aware of, nobody's even remotely discussed if and when it would be enacted. We do know that according to the World Health Organization and the National Institutes of Health, dexamethasone should never be given to anyone who is not on supplemental oxygen or a ventilator. This is a sort of last-ditch medicine for people who are dying of coronavirus. Now, I do understand the desire to give it to Trump early in an effort to head it off at the pass, but doctors usually aren't permitted to do that. They're expected to do what's in the best interest of the patient, and they don't give that drug to patients until it gets, because it's a serious fucking drug. So either it would appear that either somebody's behaving unethically because he's the president of the United States and they're throwing things at it that they really shouldn't be throwing at it, or he's sicker than we're being told. I did also note that when asked about him leaving, Walter Reed, the doctor in charge, said that he, quote, meets all the necessary requirements to leave. That's cute. That's very cute. There's only one necessary requirement to leave. He says he's leaving and signs a waiver that he's leaving against medical advice. That's the one requirement. If he's met that, he's met all the requirements to leave the hospital. They didn't say he met all the requirements to be discharged. Any doctor knows the difference between those two statements. At any rate, Don Jr. is purportedly profoundly upset by his father's behavior at Walter Reed, the going or doing the circle around the hospital and leaving early. He has asked his family to engage with him in a kind of intervention. Purportedly, Jared and Ivanka have said that they concur and are very concerned, but they believe they should support their father, and that's what they're doing. They're telling him that they love him, that he's doing a great job, everything's going great, but that they are secretly concerned. But they've told Don that they will not support him actually confronting their father, and he has said he won't do it alone. Generally, I try to stay out of family gossip, but in this particular case, that's what a source close to Don Jr. has said, and he appears to be profoundly concerned for his father's health. Here we go. White House Press Secretary Kayleigh McKinney has tested positive for coronavirus. There's been considerable backlash from reporters since she has been without a mask at virtually all of her press briefings. It has also been suggested that she may have tested positive prior till now and hidden the results. Melania Trump, Hope Hicks, Trump's body man Nick Luna, Kellyanne Conway, Trump's campaign manager Bill Stefan, chairwoman of the Republican National Committee Rhonda McDaniel, former New Jersey Governor Chris Christie, Republican Senators Thomas Tills, Mike Lee, and Ron Johnson, Assistant Press Secretaries Caroline Levitt and Jalen Drummond, as well as the Principal Assistant Press Secretary Chad Gilmorth, and 4 more aides in the press secretary office of the press secretary have all tested positive in the last few days. Vice Commandant of the Coast Guard, Admiral Charles Ray, has tested positive, prompting the Joint Chiefs of Staff and several Pentagon leaders to quarantine 11 members of the advance team and the debate prep staff for Cleveland have all now tested positive. 3 reporters have now tested positive. That is 35 new positives in the general orbit of the White House in just under 1 week. And the first thing Trump did was take off the mask. I'll say this to the idiot in the live chat, and he's an idiot. Well, actually, he's not. He's just a troll. He's faking. So I don't believe very many people are that stupid. Trump is, but it's very simple. We could have prevented 90% of the deaths if everybody just wore a mask. What does it cost you to wear a mask? Your freedom? You have to wear clothing. You have to wear clothing. Why do you hate America? Why do you want 200,000 of your countrymen dead because a mask is inconvenient and you think it's macho to not wear a mask? No. No, that's insanity. That's lunacy. The mask would have no impact on, if we didn't close the bars, if we didn't close the restaurants, if we didn't close anything, just made everybody wear masks, just like you wear clothing, 90% of the dead people would still be fine. But hey, you could die from the flu, you could die from a car wreck, so it's okay. What kind of idiot makes that argument? At any rate, sorry, the commander-in-chief, I forgot. The Republican committee chairman of the Craig's Head County in Arkansas died today of COVID-19. His committee hosted a gathering last month where masks were not used and social distancing was not practiced. So 35 new positives. Now, essentially, really most of that, not all, but the vast majority since Trump tested positive. So that's been, 3 or 4 days? Some of those, Hope Hicks was earlier than that. But people are keeping an eye on Biden, keeping an eye on Pence, keeping an eye on, I'm a little tired, excuse me, Speaker of the House, holy smoke. Pelosi. I could see the. So that's where we stand. There is a possibility that he's not going to get any symptoms, given what we know of his health and given the information that is being withheld that could so easily be dispositive. If Trump wants to demonstrate that he's healthy, release the. If Trump wants to demonstrate he's not a crook, release your taxes. Release your taxes. If there's nothing to hide, you're running for president. Everyone else is release your taxes. He wants to demonstrate he's strong and healthy. You don't have to release your lung. You don't have to release your the actual X-ray, but let the doctors say what they found. Other presidents have done it. Plenty of other presidents have done it. We've had presidents who were in wheelchairs during and they were strong. They fought world wars. I don't think this man has any idea what constitutes real strength. At any rate, given the lack of information, given the secrecy, given what we do know about the drugs that have been given him, which appears to have been a full court press, and given what aides have said and what we've seen a little bit in photos and speeches, there is reason to believe, and just given the statistics, there's reason to believe he is not even close to out of the woods. In fact, that this is closer to the beginning of his illness than the end. We do know this was advised to him upon leaving, and most of his political advisors said, don't go, it's going to look a lot worse if you have to come back. But he left. My guess is within 3 days, we'll have a pretty good idea of whether or not he's going to have to go back. If 3 days from now he's jumping around doing stuff, I'll admit I'll be genuinely fucking impressed. The evidence doesn't lean in that direction. So that's where we stand. We will be covering the election live, starting, I believe we're slated to start at about 6. We will have from Fundamentally Flawed, Alex Boughton and Jim Gardner. We will have Christopher Mouty. I believe Nate has confirmed. Actually, I don't know if Nate's confirmed. Anybody listening to this, make sure you tell Nate to confirm for coming to his coming to this show on election night. We want to have them, and make sure Cirrus confirms with me for tomorrow night on discussing Schadenfreude and is it okay to wish harm to another human being, in this case specifically, the commander-in-chief for whatever reason. So we'll have that discussion. But in the meantime, thank you all for joining us. We will see you again for tomorrow's show, which is at 9 p.m. And then, like I said, we'll probably do a very brief, just a nick of time, on Monday, and then World War III on Tuesday. So thank you all for joining us, and we look forward to seeing you in the Discord. I'll be there in about 5 minutes, so we'll drop a link to that. Thank you, Jake, again for your support, and we'll see you all soon.